are having a hard time in connecting, so
in order
we
to
should not
save
lose
time and not to waste more time. We can maybe start
some half
right
hours, so
away.
let's start.
I don't know
hope
if
that everything is set,
everything is
and
in order, but
at the
first and
outset,
foremost,
I would like to express our excuses on behalf of these two personalities.
Apologize for the absence of those who should have participated in this meeting, and I give the floor to my colleague so that she presents the draft, the agenda.
And others can join us while we conduct our meeting.
Can we start now?
So, security intelligence.
Madame
now,
Awa,
can we please start?
I
Madame
give
Awa,
you the floor now.
you have Madame Awa, you have the floor. Thank you. Thank you, Mr. Gali.
Mr. Gali.
Mr. Gali is
General
the
Secretary in charge
Legislative
of
Matters
Judicial Affairs. I'd like to thank first and
Secretary. I would like
foremost
to thank the Secretariat and the Pan-African leadership
of the Pan-African Parliment that has supported us in this process of organizing this meeting
to organize this first briefing session.
Virtual briefing session.
In this regard, I would like to address the Women Caucus President, though she's not present.
I'd like to mention the President of the Women's Caucus
in Zambia
that has started this activity. And I would
like to express excuses. She was not able to join us online in this briefing, and the connection, the internet connection where she is a little bit unstable. I would like to recognize here the
regional caucus
representatives, president of Pan-African standing committees. We have gender equality, people with disability commission, and we have the president of the Human Resources Tourism Commission as well. I would like to recognize the participation of the president of other standing committees and caucuses, members of Pan-African Parliament, who are able to join in this meeting. We have also representatives of the African Union departments. We have the Gender and Social Affairs Department representatives here. We have representatives from the United Nations, UNFPA, and ECA. We also have other guests and
invitees, all protocols
I welcome you to this information session. This is a virtual information on the
COVID-19 and
gender-based
violence
and gender-based violence that this pandemic entailed. I'd like to thank honorable members despite their workload and sometimes in difficult situations in their countries were able to respond to our invitation. I would like as well to express the regrets of
my thanks to the Honorable Miti, the President
of Women Caucus from Zambia, who is not able to join us here,
from Zambia,
and also other members
join us today,
who had to make presentations here, members from Rwanda, for instance, and who is not able to join us here because some member of his family is in the hospital. So I'd like to congratulate the UNFPA, who has brought for the past 10 years its support to the Pan-African Parliament and mainly to the Women Caucus regarding this
the preparation of the present program and other activities
that we have carried out in the past, mainly activities related
within the context of gender-responsive approaches, especially female genital mutilation.
To recognize the high commitment of the Gender, Women and Development Department of the African Commission, with which we have undertook carried out some activities last year, and which is our main partners in activities related to gender. The Pan-African Parliament has put in place the necessary means to implement the initiatives of the African Union and its partners to address COVID-19
to fight COVID-19
consequences, mainly on women and young girls.
COVID-19 on women and girls.
The UP Bureau has a program now and
would like to take
has given due attention on the aspects that need to be analyzed in details
of the agenda.
We can have some activities here which can be mentioned. It's to support and strengthen the role of the Pan-African Parliament and national parliaments control or supervision role on national response plan by taking into account the gender
responsive
aspect.
COVID-19 national plans.
The second point of this program targets to support Pan-African parliamentarians to work with their government and national parliaments in all aspects related to resource allocation, financial resource allocation available to address COVID effects
of COVID-19.
Finally, we have this issue on violence against women
that
is now increasing during this pandemic.
So we have
developed a series of activities focusing on a few important points, which starts by this first activity, which is the briefing on this program. Then we have the development of a roadmap to be able to implement this program. We also plan to develop a guideline, which should be a list of items to develop and help parliamentarians to help their governments in gender-sensitive response plan. We also have a series of regional seminars that we have planned, which would be organized at regional level to build the capacities of
in order to
Pan-African Parliament Caucus members, but also members of standing committees at national level in all aspects related to the development of draft laws and support legislations that would have the objective to support national plans to fight against COVID at national level. And in all this planning, these countries would work with the UNFPA offices at national level. So the details of all these activities and objectives will be detailed and in the program that we have developed today, and it will start by an opening session, which should be conducted by the senior assistant,
will be read by the chairperson of the
by Mr. Gali, replacing the
Mr. VP
Arawa, who is not able to connect. And we will have a presentation on COVID and gender-based violence made by Madame Caroline Gozzi, which is the
COVID-19 national plans, by
acting head of UNFPA within AUC and ECA. Mr. Gali would also have an interactive remarks by Jamil Dures, who is not able to connect here. Then we have a session on interactive discussions on the following items. The first presentation would be on the impact of COVID on gender-based violence at the national level. And this presentation will be made by the UNFPA Liaison Office and regional offices. The second presentation of this first session would be on the impact of COVID-19 on gender equality and women's empowerment of the African Union. This will be made by Madame
We'll have another
Following that, we will have a question and answer session.
And we
will also have some presentations or communications by parliamentarians. So we have recognized South Africa, Burkina Faso, Benin, and Rwanda, and Senegal, who has just been added to the list. Then we would have a few minutes for panelists to address the questions.
Raised.
The second session would be
concerning
on the presentations
on
harmful practices, mainly female genital mutilation and child marriage.
A presentation that will be done by Ms.
Nena Tundu
from the Department of Social Affairs of the African Union Commission.
The second presentation of the second session would be on reviewing
examining
policy solutions to address the
impact of COVID-19 on women.
To be presented by Madame Tokozile, who is the Director
Poverty and Social Policy Division of the United Nations Economic Commission for Africa.
After these two presentations, we will
have an open session,
discussion session, and questions from panelists.
Third session,
the third session will be on the expected results of this program.
We're going to review objectives, activities and timelines
that you're going to
presented by
validate
the UNFPA
before
liaison office to the
closing the session.
ECA.
So I have tried to summarize the agenda of today, and I hope that we would be able to start our deliberations. I would like to express my excuses due to the delay of our opening of our session. Let me give the floor now to Mr. Gali for his opening remarks.
Merci, Madame Wawa.
Thank you, Madame
Wawa.
Hello,
good
honorable participants, ladies and gentlemen.
Good day, ladies and gentlemen,
Dear participants, welcome.
Good morning, representatives of the various departments of the African Union Commission, ladies and gentlemen,
representatives
coming from the UN family present in this meeting.
I'd like
Let me express my excuses
on behalf of the General Secretary
who is not able
who
to
hasn't been able to join us. And I'd like to welcome you at this meeting.
In this meeting, which is the first of its kind, and which would have a follow-up meeting in light of the planned activities that were just
presented
detailed by Madame Wawa.
I would like to apologize
our excuses
on behalf
of Honorable Uwas, who is having difficulties in connecting to this meeting. We are very much glad to see this partnership being collaboration between UNFPA and Pan-African Parliment through
Parliament, Women's
the
Caucus,
Women Parliamentarian
and the
Caucus. And we'd like to support this activity and
the support of
say that the Pan-African Parliament is very much committed for the technical support to be provided to this activity that we are just starting today and which is going to be
in the future. On this
implemented.
I would like to
let me now communicate the welcoming remarks of the Secretary General
and save time.
And I'd like to save time here because Honorable Boras is not able to connect.
Couldn't connect to this meeting, and I'd like to
presenting his opening remarks of this session. Having said that, I would like to request Madame Awa to go to the next.
To ask Madame Wawa to welcome the next speaker.
Your Excellency.
Thank you very much.
Your Excellency, I'm sorry to interrupt. Can I please interrupt before Madame Wawa speaks? We have two interpreters in English, male and female. Can we please have one interpreter because it's confusing? Thank you. The English interpretation is being done by two people simultaneously.
Please, colleague interpreters, can you solve this issue, please?
We will do.
Est-ce que c'est réglé? Est-ce que nous pouvons continuer?
Please go on.
2 minutes, Madame Wawa. Excusez-moi, 2 minutes. On a signalé le problème. On essaye de voir du côté du FNUAP, du côté technique, du côté.
The issue has been addressed. The issue has been addressed. You will be having one interpreter now. Sorry for the inconvenience.
Okay.
Please proceed.
Est-ce que c'est bon? Nous pouvons continuer?
Yes, please go on.
Je donne donc la parole à Madame Caroline.
I give the floor now to Madame Caroline Gauzet, who is
africaine et de la CEA.
the liaison office head within AUC and ECA. Madame Caroline, you have the floor.
Thank you very much, Madame Josiane Wawa, for this. Excellencies, honorable members of parliament, distinguished participants, colleagues from the Africa Union, from the UN family, good morning, good afternoon, wherever you are joining us from. And I'd like to thank you for being part of this discussion. As we start this webinar discussion, I'd like to take us back 25, 26 years, back to the International Conference on Population and Development in 1994 in Cairo, that gave us the ICPD Program of Action. The following year, we had the Beijing Declaration and Platform from Action from the 4th Women Conference that was held in Beijing around this particular time in September. And I feel greatly privileged to be able to speak to you because it is during this September time that we're also discussing a very critical element of these two agendas, gender-based violence within the context of this COVID-19 pandemic. Accelerating the unfinished agendas of Cairo and Beijing as related to gender-based violence is particularly critical because this COVID-19 pandemic has compounded existing gender inequalities and increased the risk and incidences of gender-based violence. If we start looking at the figures right now, in very seminal studies undertaken by UNFPA and also other studies complemented by the other studies from the Africa Union, from the UN family, we actually saw that 6 months of lockdown would result in an additional 31 million cases of gender-based violence. 6 months of lockdown would actually increase female genital mutilation by an additional 2 million figures. We know that 6 months of a lockdown from the pandemic would actually result in 13 million more child marriages. And finally, we know that the confinement and restriction of movement as a result of the COVID-19 pandemic would result in 47 million women in low and middle income countries not accessing modern contraceptive, resulting in an additional 7 million unwanted pregnancies. Those figures are staggering. As you can see, the impact of COVID-19 and on gender-based violence and harmful practices. Now, we do know that COVID-19 is actually interrupting programs right now in Africa that are dealing with gender-based violence and harmful practices, where we know that more than 125 million girls and women have undergone female genital mutilation. We also know that more than 50 girls under the age of 14 years old are at risk of FGM. This risk is exacerbated as a result of COVID-19 and the lockdown. And also, we know that more than 115 million women and girls were married as children. And if something does not change, if there is no accelerated action, it will take almost 50 years to end child marriage. And I think we really cannot stand for that. And as we look at the COVID-19 national policy and program responses, we do know that implementation of the COVID-19 responses at country level would need to address both the practical needs of women and girls and also their strategic interest in relation to preventing and responding to gender-based violence. And by practical needs, I'm talking about an example of an immediate protection, immediate security need. Do we have safe houses, gender-based violence shelters? one-stop centers to actually provide bodily integrity and security for victims of gender-based violence within this COVID-19 pandemic. Also, as a practical need, do we have access to medical services, medication, and trained personnel for the clinical management of gender-based violence when it happens? We're also looking at issues of access to information for excluded women and girls, including women with disabilities. Is there accessible information potentially in sign language? Do we have digital technology that helps those with disabilities access information on gender-based violence within this COVID-19 pandemic? We also looked at the issue of masks. Do we have masks that actually that provide the kind of access and information required by persons with disabilities? And as we look at strategic interests, in terms of policies, in the medium to long term, do we have gender responsive social protection systems and mechanisms in place that deal with the specific needs of women and girls? We're talking about issues also of surveillance and response systems that include disaggregated data on health, whether it's by age, by sex, by pregnancy, by disability, because it's the data that will inform the policy making at national level as we respond to COVID-19. As well, we're also looking at issues of paid parental leave and shared responsibility for care for those in the formal sector. And this is for care for persons suffering from COVID-19, whether it's home-based care, whether it's the elderly. And this is where we are looking at issues of unpaid care work and domestic work in the home. Who is shielding? Who is actually taking care of the larger burden of unpaid care work in the home and domestic care work during this COVID-19 pandemic? So who is looking after the children? Who is looking after the elderly? Who is taking care of the patients in the home-based care system for COVID-19? So we know from studies that women bear this burden 3 times more than men. And so we are looking at issues of recognition of unpaid care work and domestic work, reduction of this work, and redistribution of the work to ensure that the COVID-19 response at national level actually addresses the specific needs of the household. We're also talking about issues of capacity building of healthcare workers at all levels to respond to gender-based violence. Are the healthcare workers trained on prevention? Are they trained on response to see how do they do the clinical management of gender-based violence, whether it's specifically sexual assault, rape, and things like that? So as we look at both the practical needs, we also need to look at the strategic interests at national level as we design our COVID-19 response plan. And now, as we actually look at issues of prevention, risk mitigation, and coordination of COVID-19 responses at national level, I would just want to pick on the 6 key thematic focus areas that would actually need and require specific gender responsive COVID-19 national plans. And here we're looking at the immediate protection needs of the victims and survivors of GBV. Issues of GBV, as we mentioned before, safe houses, one-stop centers. We're also looking at the medical response to gender-based violence. Here we are looking at issues of clinical management of gender-based violence, sexual assault, and practices. We're also looking at the psychosocial support in terms of counseling and therapy. Do we have hotlines? Are people reporting through WhatsApp? What is the method of psychosocial support being provided to victims, to survivors, to those at risk of gender-based violence? Even as we look at the judicial and legal responses, we're looking at issues of access to child-friendly court systems in the country for child victims of gender-based violence and harmful practices. We're looking at issues of capacity building of the officers within the judicial legal system to respond to gender-based violence within COVID-19. And we all know that many times a lot of the resources from some of these services are actually reallocated yet this is a crucial, essential service as we deal with gender-based violence and COVID-19. Also, a critical issue that would come up, I'm sure, as we discuss, is the issue of access to economic empowerment opportunities for survivors and victims of gender-based violence, still within these COVID-19 responses, looking at issues of capacity building, economic empowerment of women and men as well. We're looking at issues specifically that hinder women's access to capacity building interventions. We are looking at access to finance, access to markets and market information, and the opportunities that are there within the African Continental Free Trade Agreement area, even as we recover, as that has been touted as one of the key recovery pathways for COVID-19 for the continent. So do we have gender responsive policies that would support women's engagement and participation within the African Continental Free Trade Agreement, Free Trade Area Agreement? Also, a key issue to look at is access to education opportunities. Numerous studies have been carried out that show that with the recent lockdowns and the closing of schools, millions of girls will be unlikely to go back to school once the lockdown starts opening up, because possibly they have been married off, possibly there is other responsibilities that they have taken up during the lockdown period. So issues of access to education opportunities for girls and women is a key component, even as we look at COVID-19 national response plans, couched within the framework of the practical needs of women and girls and their strategic interests in the policy environment going forward. And I will finish my intervention by talking about the partnership that we have going forward. Thank you very much, Madam Josiane, who gave a very good summary of the partnership and actions going forward in support of parliamentary support to gender responsive COVID-19 national plans. And we are excited and happy about this partnership with the Pan-African Parliament, with the African Union, with our UN sister agencies, ECA as well. And we look forward to a very extremely engaging partnership that will definitely provide tangible results for the women and girls of Africa who cannot wait. Thank you very much.
Merci Caroline, merci pour
Thank you, Caroline. Thank you for the details that you just gave us. These are very indeed important points. Let me give the floor now to Mr. Gali. So was the president able to connect, or do you have a few words to say on his behalf? Mr. Gali? Thank you, Madam. I do not see that the president was able to connect unless the technical team gives us an update on whether he's connected or not. So he was not able to connect and join us. So you're going to give us the opening remarks on his behalf. Thank you. Let me precise here at the outset that these welcoming remarks are those of the acting president, Honorable Jamel Bourras. President of Women Parliamentarians, Caucus, President of Regional Caucuses, President of Gender Equality, Family, Youth, People with Disability, and Education Caucus, Caucus of Culture and Human Resources as well, President of other standing committees, honorable members. ladies and gentlemen, representatives of the African Union Commission Department, ladies and gentlemen from the UN family, ladies and gentlemen, members of the Secretariat of the Pan-African Parliament, honorable guests, I would like to welcome you all to this virtual information session on the consequences of COVID-19, impacts of COVID-19 and gender-based violence that this pandemic entailed. At the outset, I would like to thank UNFPA for their support to the Pan-African Parliament, mainly to the Women Caucus since 2014. UNFPA strengthened the knowledge and build the capacity of Pan-African Parliament Women Caucus members in the areas of harmful practices such as female genital mutilation and child marriage, which are threats of human rights and human dignity. Allow me now to congratulate the Women Caucus of the Pan-African Parliament, which since its establishment in 2007 provides quality expertise on women issues and makes sure that PAP is committed to implement the African Union principles as enshrined under Article 4 of the Constitutive Acts pertaining to the promotion of gender equality. Ladies and gentlemen, during the last joint evaluation by the Women Gender Department of the African Union Commission, it was mentioned, among others, some unfortunate observations. 70% of African women live with less than $1 per day. Africa is losing 23% of its economy because of gender inequality. Work done by women represents 60% of the unremunerated activity. The lack of economic empowerment of women and the limited policies on access of education and their empowerment is still persistent in the continent. The new data on the impact of COVID-19 show an exacerbation of the difficult conditions of women on health, security, and socioeconomic aspects. Since the beginning of the pandemic of COVID-19 in Africa, Pan-African parliamentarians joined their forces with the leaders of the continent in the fight against these unfortunate events. The Pan-African Parliament committed to put in place all the necessary means to ensure the implementation of the key continental initiatives to address the effects of COVID-19. Dear parliamentarians, you have a major role to play in the implementation of legislation, international legislations and policies, as well as regional and national policies who promote and protect rights of women and create a safe environment to women and girls in their respective countries. I urge you now to deploy all the necessary efforts in your respective countries to allow the continent to overcome these challenges entailed by COVID-19. Ladies and gentlemen, women, African women parliamentarians, have a huge responsibility in creation of awareness, the support of women groups, the initiative in promoting, in developing draft laws, and the promotion of draft laws to protect women against all sorts of violence, mainly those related to gender, since the beginning of COVID-19. Their responsibility also goes in sensitization of the local communities and projects targeting women and girls' empowerment. In this regard, the Pan-African
s'engage à appuyer toutes les actions et décisions
commits to support all actions and decisions coming out from the PAP UNFPA initiatives to fight these inequalities between gender and the ever-increasing of gender-based violence due to COVID-19. I would like to wish full success to this initiative, and I officially open this virtual information session. Long live the Pan-African Parliament. Long live the African Union. Long live the African women, and long live Africa. I thank you very much for your kind attention. This is on behalf of Honorable Bourras. Thank you very much for your attention.
Merci, Monsieur Gali. Merci de...
Thank you, Mr. Gali. Thank you for communicating the message of Honorable Jamel Bourras. Without further ado, I think it's important that we dive now into our main agenda with the first presentation. The first presentation would be on the impact of COVID-19 on gender-based violence at regional and continental level. This presentation would be made by UNFPA Liaison Office representative and members of the regional bureaus. Madam Caroline, can you please tell us who would make this presentation?
Thank you very much, Madam Josiane. From the UNFPA regional offices, we will have 3 presentations. The first one from the East and Southern Africa Regional Office by Ms. Julie Diallo. She will be followed by our West and Central Africa Regional Office, Mr. Idrissa Wedrago, and then we will wind up with the Arab States Regional Office with a presentation from Hanan Rabani. Thank you.
Merci.
Thank you.
Donc, Madame Julie Diallo.
Madame Julie Diallo, we give you the floor now.
Bonjour, good morning, and thank you very much for the opportunity. All protocol observed. I will share with you my screen with the presentation that I have prepared to speak a little bit about the experience from East and Southern Africa in the way that UNFPA has been responding to gender-based violence in the context of COVID-19. So I will make sure that you can see my presentation. Can you see my presentation?
Not yet.
One second. 1 second. Okay. Voilà.
Okay. Perfect.
Voilà. Thank you. So I will speak a little bit about our experience in responding to GBV and harmful practices in the context of the COVID-19 in East and Southern Africa. I wanted to start by that slide showing really like the picture of different women and the face of women in the COVID-19 pandemic in our region and in our continent. Just as a context, what we have been seeing as UNFPA East and Southern Africa, looking at the region in terms of COVID-19, it's really like the limited health system response, and testing capacity. And what we have seen is that some of the COVID-19 measures to prevent the spread of the virus really deepen and exacerbate existing inequality, with issues related to food insecurity, and especially affecting disproportionately women and girls, and also children, as we know, because this is one as a consequences of the school closure. As UNFPA, we did in May 2020, we did a SNAP analysis looking at how many countries in the region have recognized GBV as essential services as part of the COVID-19 response. And what we have seen is that we have 13 countries in East and Southern Africa out of the 23 countries that we cover as UNFPA that have considered as an essential services. So we found that this is really like a good practices to have that recognized. But when we look on the ground, even if those services were considered as essential, we could see that they were not matched with adequate resource allocation and as well capacities. And indeed, what we have seen is really like the disruption of sexual reproductive health and right and GBV services on the ground that is characterized by limited access to shelters. So in some contexts, there was no shelter for a woman and girl victim or survivor of gender-based violence. What we have also been seeing is that you have some civil society organization-based services that were disrupted due to the COVID-19 measure. And we also have seen like a disruption in the supply and availability of GBV and SRHR commodities, such as contraception, but also such as GBV kits. So this is a little bit in terms of context. And so in relation to GBV, we can really speak about the shadow pandemic, because what we have been seeing is a sharp increase in violence against women and girls, including harmful practices. And in relation to harmful practices, what we have is some anecdotal data related to increase of FGM as well as child marriage in a region as a way of negatively coping to the COVID-19 situation. And so what we see globally, it's a 13% increase of GBV reported cases. And in a region, we see a similar trend and even higher trends than 30%. But it's important to look at the data with cautious, because in some contexts, we have not seen an increase of reported case of GBV. And this really can be due to the fact that women and girls at risk of survival of GBV do not have access to tools such as phone, internet, to be able to report cases. And in relation to that, what we have seen in the region, it's a shift of reporting from outline to WhatsApp, chatbot, Skype, to really find a new method to a reported case of GBV in the COVID-19 context. So I just wanted to share that table as information for you in relation to data that we have been collected in terms of increase of reported GBV cases. And so if you take the example of Zimbabwe, what we have been seeing is a 90% increase in GBV calls that were recorded by the Zimbabwean national outline. And we can see that this really was an increase from March to May, which is quite a sharp increase. And also in those 90% increase, it's mainly intimate partner violence cases. So what has been UNFPA response in response to GBV in the COVID-19 context? So the first things that we have been really focusing on is about prevention and risk mitigation. So what we have been doing, it's really working with ensuring that there is an integration of GBV prevention messaging into existing COVID-19 messaging. And we have been using social media, radio, television, really to convey the message about GBV and also to ensure that there is accurate information about what is the existing referral pathway at country level. And as you can see the picture below, it's my colleagues Mireille Icoli from the Democratic Republic of Congo that have been doing like some information about GBV online on Facebook, but also on Twitter, to ensure that we reach out a maximum of women and girls at risk of GBV. And at the regional level, we have been working with different actors to ensure that we develop like some guidance on how do we communicate on GBV in the COVID-19 context, as well as developing like key messaging, looking at how do we address, how do we speak about GBV at community and grassroots level. In those prevention and risk mitigation, we also have been engaging with the armed force to ensure that they have awareness about the issue of GBV in the COVID-19 context and that they can respond to GBV case in the current context in an adequate manner. The second part of our response, it's really like the core of UNFPA. It's about the GBV services. And it's really about how do we strengthen GBV services access and quality to women and girls in the current context. And so at country level, we have been working on different fronts. So one of the first things that we have been doing, it's really like setting up, upscaling, strengthening existing outline, and also like creating GBV outline to ensure that a survivor or women and girls at risk of GBV can have access to information. As part of those outline, we have also supported a psychosocial support to GBV frontliner responding on the ground. Another key element part of the services is the strengthening and expanding of shelter and one-stop center. So what we have been doing is that in contexts where no shelter were available, we have supported the setting up of shelter. We have also supporting the repositioning of existing location to ensure that women and girls survivor and at risk could have access to a safe space, providing services, providing food, and providing basic items. What we have been doing as well is strengthening existing community-based mechanisms. So ensuring that at community level, young women and girls have access to information about the referral pathway, information about the access, information about services. Another element that we have been really working on, it's about the dignity kit. And we have changed the dignity kit. So the dignity kit, you know, it's that bag where women and girls can have basic items to really ensure that their dignity is respected. And we have changed it in the COVID-19 context, putting a sanitizer, putting phone, SIM cards, data to be able to have access internet and as well credit to ensure that women and girls can reach out, outline, reach out services in case they are at risk of GBV. And we have been working in partnership with the World Food Program to link the distribution of dignity kit with the food distribution. And this was quite effective. Another thing that we have been doing is that to ensure that we reach out women and girls in hard-to-reach community and that we leave no one behind, we have setting up mobile GBV clinic to respond and to really ensure that the hard-to-reach have access to those services. And one of the models very successful that we have setting up in Zimbabwe is the mobile one-stop center. So the one-stop center is a model that provides like a multi-sectoral response to GBV, including health, justice, police, and psychosocial support. And in Zimbabwe, what we have been doing is having like a van with the different service providers from the different sector moving in community to ensure that people at risk, women and girls, have access to that multi-sectoral and quality GBV response. And at the regional level, we have been working really at inter-agency level to strengthen the capacity of GBV service provider and to really adapt the response in the COVID-19 in the COVID-19 context, ensuring that they can provide remote quality GBV services. This links to another element of our response is the capacity building. And at country level, we have been working with the health sector to ensure that they can do GBV case management and provide like a GBV quality response, ensuring that they can refer the survivor or the woman or girls at risk to the quality services. We also have been working a lot with the Ministry of Justice and the justice sector to strengthen the capacity to be able to deliver remote justice services for women and girls survivors or at risk of GBV. And we also have been working with the GBV service provider to ensure that they adapt to the COVID-19 response and provide a remote or mobile GBV response. And at the regional level, we have been working on ensuring that there is a delivery of regional capacity development for service provider and as well as GBV stakeholder. Another element is about the importance of data collection, ensuring that we collect age disaggregated and sex disaggregated data, but as well that we collect women and girls data on women and girls protection issue. And for that, what we have been doing, it's really working with the different GBV service provider at shelters, outline to really strengthen the capacity to collect that data, but to use that data to inform the COVID-19 response plan, but also know that we are working with them to how do we use those data to inform the recovery, the COVID-19 recovery plan. Sorry. And the last element of our response was really about advocacy and interagency initiative and how we have been working with through different interagency level. So for example, in East and Southern Africa, we have a regional working group on GBV, and we have been developing advocacy position paper, for example, on how to ensure that GBV services are considered as essential services. There is also an interagency on continuity of services, and we also have been working through that interagency group on how do we ensure that SRHR and GBV services are considered as essential services and that there is adequate allocation resources matching to those services. And so several advocacy initiatives, both at regional and at country level, ensuring that we have sex and disaggregated data informing our advocacy messaging, and also that we have strong gender analysis informing our work on advocacy and on advocacy initiative. So maybe my final point, it's really like about key recommendation to really ensure that we build back better after COVID-19, but also that with COVID-19, we have also like an opportunity to build differently, ensuring that the need of women and girls affected disproportionately by COVID-19 are really at the center of the way that we are going to respond and respond better. So the first one, in terms of like key messaging, it's really about the need to recognize GBV as essential services under the COVID-19 national response, but also in the recovery plan. So that means that we really need to ensure that there is adequate financial resource matching those services, and there is adequate human resources to deliver those life-saving services. The second recommendation would be really about the inclusivity and ensuring that the COVID-19 national response and recovery plan are inclusive, really looking at those women and girls that are left behind. And by now, we really know it's women and girls with disability, it's women and girls living in remote area, women and girls coming from indigenous community, nomadic, refugee women, internally displaced women. We know that really those women are generally the one left behind. So we need to make an effort to ensure that the need and concern are informing those recovery plans and the way that we respond in COVID-19. A third recommendation would be to ensure that we have COVID-19 national response plans and recovery plan that are gender responsive. And by that, what we not seeing happening in a very consistent manner, it's that women and girls are absent of the table of the COVID-19 decision-making process to really inform the solution and the recovery effort. So we really have that opportunity to really push to ensure that women and girls are at that table and that the needs and concern really inform the way that we respond and the way that we will back better after COVID-19. And the last recommendation is about the social protection mechanisms. We need to ensure that social protection mechanisms and economic stimulus package properly responds to the need and demand of women and girls. And so we need to have targeted assistance to vulnerable and girls, including in the informal sector. Because what we are seeing as UNFPA, as we have been supported several countries in the socio-economic the COVID-19 socio-economic assessment, we are really seeing that women and girls are absent in terms of the way there is really limited targeted response to women and girls in those socio-economic assessments. So this is also something that it's quite critical, know that we are in the recovery phase to ensure that we have targeted intervention to them. And the final one, it's about the provision of high-quality technical support on gender mainstreaming in the COVID-19 response and recovery plan. So to ensure that we have a strong gender analysis that is really informing the way that we respond, that we have sex disaggregated data and age disaggregated data and also location disaggregated data to ensure that we really reach the one that generally are not reached and the one that is most at risk. And I think really the United Nations system, UNFPA and other agencies really can provide that support to member states in terms of the analysis and in terms of the data component to ensure that we have a response that is gender responsive. So thank you very much.
Thank you very much, Julie, for this in-depth analysis of SRO and also those very pertinent recommendations. We have another presentation. I think we'll just go directly to the presentation of the African Union Commission. So Mrs. Elwat, can you
bonjour.
Take the floor? Merci. Bonjour, bonjour Elwat.
Bonjour. Merci beaucoup. Excellence, honorable parlementaire.
Very much. Excellencies, parliamentarians, I'd like to switch on to the video now. Excellencies, honorable parliamentarians, guests, all protocols observed. On behalf of Madame Victoria Maloka, who is the acting director of Women and Gender Development within the African Union Commission, and on my behalf, allow me first to express my gratitude to be part of this important virtual consultation of the Pan-African Parliment Women Caucus on the exacerbation of gender-based violence following COVID-19. As the previous presentations highlighted, gender-based violence is one of the main obstacles in the achievement of their fundamental rights. Just to give you an overview of the impact of the pandemic on gender equality and women empowerment, I'm going to present first the guidelines on the gender response that we developed within our directorate of the AU. As you know, during the previous pandemics in Africa, such as Ebola, women and young girls were the most affected by the socio-economic effects of these health crises. The guidelines have the objective to limit to the maximum the impact of the pandemic on women by proposing specific actions focusing on the gender aspect. We have to recognize the multidimensional aspect of the pandemic, where women and children are affected. First, in the economic sector, we have the peace, security, agriculture areas as well, health, education, and other cross-sectorial aspects. This is in line with the principles and objective of the Agenda 2063 and the UN 2030 agenda, which promotes gender equality at the global level. Our guideline complete the response at the continental level, led by the African Union Commission through Africa CDC and the Department of Social Affairs. We have 8 principles of facilitation and success factors, which is the considering of the gender aspect, data disaggregated by gender, gender budgeting, a program with high impact and whose ownership is at regional, national, and continental level, strategic partnerships and multi-sectoral approach, effective inclusion of women, and the respect of commitments and legislations in promoting women and children and ensure women empowerment. Finally, documentation and experience sharing of best practices. They highlight what we call the shadow pandemic, which refers to the gender-based violence, as it was said earlier in Africa and also elsewhere in the world. Gender-based violence has drastically increased. The confinement and social distancing are one of the factors. On the other hand, the closure of schools have increased these harmful practices, early marriages, and also rapes, incest, and also violence against children, specifically on girls. Legal protection is limited due to the suspension of the judicial system in several countries. Women and girls are not having justice, and they are constrained to live within the same household with the perpetrator. So while recognizing the necessity to promote a global response, we have increased our efforts to increase the gender mainstreaming aspect in our COVID-19 response. We have carried out a series of consultations with member states at the ministerial level. Ministers of Foreign Affairs, ministers of gender and women. We have also engaged with the civil societies in the continent, and we have also discussed with the regional economic communities. We have launched the AU campaign to eliminate violence against women and girls, which will start during the 16 days of activity. It has 3 pillars: prevention first, advocacy, and resource mobilization. Within our directorate, we have launched, in partnership with UN agencies and various departments of the African Union, we have launched several consultations. One of the consultations we carried out, and my colleague from the Department of Social Affairs would talk about it, is related to the fight against violence against girls. And the idea here is to develop guidelines for member states and the regional economic communities on the protection of girls against sexual abuses during this pandemic era. We have taken into account 2 consultations that will be conducted simultaneously. One, on to have a better overview on the impact of the pandemic on gender equality and women empowerment, and another consultation to develop a strategy and a roadmap at continental level with respective budget to respond to COVID-19, which is sensitive, which includes or which is gender responsive. We would like to encourage parliamentarians here. We are working on a webinar within the Ministry of Women and Gender, and parliamentarians and civil society representatives are part of it. So this is one of the elements of the guideline. We want to accelerate the universal ratification of the Maputo Protocol and make sure its immediate implementation at country level where it was ratified. So we would like to appreciate your efforts. We are very much glad to work with you in this endeavor and make sure women empowerment is indeed a reality for African women and girls, even within a pandemic situation such as the COVID-19 situation. We thank you. Thank you very much, Ilouad, and thank you for this presentation. We have taken note of your presentation. I'm going to give the floor now to Madame Thokozile. She has a meeting starting in a few minutes, and she has to make a presentation on the policy solutions to address the impact of COVID-19 on women. Madame Thokozile is the Director of Poverty Social Policy Division of the UNECA. Thokozile, you have the floor.
Thank you, Madam Moderator. I hope you can all hear me. Excellencies, honorable parliamentarians, I recognize the African Union Commission. I recognize the UN family, distinguished participants, and all protocols observed. I'm sure my picture is not that clear because I've got the sun behind me, but that's okay. Previous speakers have shared with us staggering figures and information on the challenges women and girls face. And the pandemic has given us more challenges. We have never been challenged like this. Therefore, this webinar comes at the most critical time where we need to have a conversation and also look at what are the policies that we are recommending and the role that the parliamentarians can play. Your role is critical. I'm going to look at 4 issues: health and gender-based violence, education, employment, and well-being. Let me start with health and GBV-related issues. Both UNFPA and the previous speakers have highlighted the challenges that we are facing with gender-based violence. Let me look at 3 issues around health and GBV. 1, the increased risk of exposure to women from COVID-19 as frontline and care workers. And then each of the points that I give you the critical issues around them, I'll then look at what are the policy responses that are needed. As we all know, women are at a greater risk of exposure to the coronavirus. The majority of nurses in Africa are female, and we know 65% of the nurses are women, while 72% of doctors are male. Nurses in many cases form the initial steps in diagnostics and testing of COVID-19, which means they are the frontline staff before the patients are admitted to specialist doctors. They also provide the critical care for COVID patients around the clock. Therefore, female nurses on the front lines of the COVID-19 are at a greater risk of exposure to the coronaviruses than male nurses and doctors. Then 2, the additional strain on healthcare and women's access to healthcare. And I know the previous speakers did speak to this point. In many countries on the continent, there are limited resources that have been allocated to healthcare, and these are being diverted for COVID-19. This has become detrimental on the impacts on other areas of the healthcare where regular emergency and outpatient services have been required, and thus compromising especially the situation of women and girls' health. Many countries, however, are trying to address this through the campaigns such as flattening the curve so that they limit the strain on healthcare systems as a whole. Because if we're able to flatten the curve of COVID-19, it means therefore the resources that are required, the health resources that are required towards COVID-19 go down. Then 3, COVID-19 has increased the incidences of GBV, and this I cannot emphasize, and I'm not going to go into the details because the previous speakers have spoken to that. Therefore, what are the policy solutions? 1, the increased risk of exposure to women from COVID-19 as frontline and care workers. And then each of the points that I give you the critical issues around them, I'll then look at what are the policy responses that are needed. As we all know, women are at a greater risk of exposure to the coronavirus. And we know 65% of the nurses in Africa are female, and we know 72% of doctors are male. Nurses in many cases form the initial steps in diagnostics and testing of COVID-19, which means they are the frontline staff before the patients are admitted to specialist doctors. They also provide the critical care for COVID patients around the clock. Therefore, female nurses on the front lines of the COVID-19 are at a greater risk of exposure to the coronaviruses than male nurses and doctors. They also provide the critical care for COVID patients around the clock. Therefore, female nurses Okay, I'm sure they are screening my my PowerPoint. So what are the policy solutions? Please, can you help to move my my PowerPoint, please? I'm on slide 4 now. Slide 4. So what are the policy solutions around health and GBV related issues that I'm recommending? 1, to ensure minimal strain on the rest of the healthcare as a whole, so that the healthcare services that are required by women and girls are provided. Then 2, to ensure adequate PPEs for frontline and healthcare and GBV workers. We know a number of COVID-19 patients without the PPE equipment that is required. Then 2, the dedicated health services for women and the vulnerable. To maintain dedicated health services to women and vulnerable people, in addition to the response and
Mrs. Tokozile, we can't hear you. I think we have lost Mrs. Tokozile. Can the host...
Hello?
Okay. Hello, yes.
Hello?
Okay. Yes, we can hear you now.
Can you hear me?
Yes.
Hello?
Hello, yes, we can hear you now. Hello?
Hello, can you hear me?
I can hear you. I don't know if others. Host, can you hear her?
Can you hear me?
Yes.
Can you hear me?
Yes, I can hear her. Yes, I can hear her.
Yeah.
Yes.
Can you confirm, please?
Okay, I'm going to stop my video because thank you. I'm going to stop my video. I'm going to stop my video because my internet is very weak.
Okay. Mrs. Tokozile, are you here? I think she have mute her mic and not the video. Can you hear me, Mrs. Tokozile? You can close your video, but please leave your mic.
No, I know I was, yes, I can hear you, but my internet. Yes, Madam Moderator, the challenge I'm facing is my internet is dropping. In case I drop completely, can my PowerPoint be shared, please?
Definitely. That's true. We will share it with the participants. Thank you.
Help is to maintain.
Okay, you can go on. Mrs. Tokozile, we have lost you completely now.
I'm back again.
Okay.
Really, my internet is dropping. I'm not sure why. I'm back. So I was saying one of the policy resolutions is to maintain dedicated health services to women and other vulnerable people, in addition to a response where within the health budget, we ring fence for the essential services that are needed for women and girls, especially on sexual and reproductive health. And I think the previous speaker to UNFPA did speak to this. Then 3, we look at policy actions that address GBV in the context of COVID-19. The figures which were shared by UNFPA are escalating. So to look at how civil society, government, and other partners can continue to engage and ensure that the figures that we normally don't get on domestic violence are at the forefront. It becomes difficult now when there is lockdown to understand what is happening within households. And that's the role of you as parliamentarians and civil society to reach out to household and get these figures. Then the provision of essential services that incorporate GBV. This hasn't been happening in a lot of countries, and it becomes crucial now with COVID-19 and identifying families that are in distress. And of course, allocating resources to adequate resources to alleviate the challenges that the vulnerable groups face. Now let me move on to the next, which is employment and income related issues. Unemployment and lost earnings. Containment measures, as we know, such as shutdown, have related to the shutdown of markets, workplaces, and of course, borders across the continent. Businesses are operating, as we know, across the continent at between 30 and 60% less employees than normal. And these measures have tended to have disproportionate impact on service sectors with high female employment, and these include textiles, garments, fresh cut flowers, travel and tourism, which has been impacted greatly by COVID-19. And we know the majority of women are in these sectors, and they have limited opportunities to work from home because of connectivity. Then two, social protection, especially for the informal employment. Across Africa, 90% of employed women are in the informal employment as compared to 83% of men. And women are often found in the vulnerable situation, including domestic workers, home-based care, as family workers in the agricultural sector in rural areas with very limited access to social protection. And I'm sure this is familiar to you because as parliamentarians, you have to push for social protection for vulnerable groups. And this situation becomes dire in the current environment. ILO has estimated that the earnings of the informal economies have declined by 81% in the first month of the crisis. And now we are almost 4 or 5 months into the crisis. We can imagine that this is almost at 98%. Also, the loss of earnings means that more women will be seeking access to financial credit as means of financial support and to cover the shortfalls through short-term borrowing and payday loans, when we know that the possibility of them returning those loans in the current situation are limited. So what are the policy recommendations that we are providing? One, cash transfer programs, which were already in place before COVID-19. These need to be expanded to ensure that poor households, especially those that are in the informal sector, are covered. And also the use of digital solutions can ensure that payments are timely, they reach the correct beneficiary, and they strengthen accountability. Because as we all know, a large number of the women in the rural areas now do have access to a phone, to a mobile phone. Also, there should be economic measures that target women-led businesses. These should be prioritized, and especially those that are in the formal sector, using both subsidized and state-backed loans, subsidized inputs, tax and social security payment deferrals, so that there is deferment around any tax payments that is expected from the informal sector as well as from the women in business. Because certainly in some countries, even women in the informal sector do pay taxes. Then discounted pricing or government reimbursed rebates, especially on spending for women. Cash can be introduced to ease the burden of financial expenditure on household items, on grocery and food as an example, whilst also, on the other hand, it's stimulating economic activities. They can be discounted at the point of sale and reimburse retail outlets through government-backed schemes, cash transfer, tax rebate, vouchers and stamps. I know in a few countries they do give vouchers and stamps to consumers, and this could be considered especially for women. And they can be helpful when you look at victims of violence and vulnerable women that have no access to food supplies. Let me now move on to education. Let me move on to the policy, to the education, to the policy solutions. Are we on the same? Are we on the same slide, please? Okay, so the policy solutions for the employment and income related include, my apologies, I think I've lost my presenter. Okay, let's move on to the impacts on education. As we all know, access to education has been affected by school closures as well as connectivity. And this has been addressed in one of the presentations. The increased burden of unpaid and domestic work during the pandemic, combined with the gender digital divide in accessing internet and mobile technology, has had a lot of impact, and especially on rural communities. And this limits the access of girls to continue learning from home. As we know, in the majority of the cities, girls are able to have access to education because they continue to receive support from their teachers through either the phone or the computer. And this hasn't been the case in the rural areas. And if you look at the gender gap in terms of access to connectivity, you look at the figure that I'm providing. In Africa, the gender gap is 41%, which is pretty high if you look at the figure that I'm showing in terms of the gender gap in having digital access. This invariably means we have a large percentage of both women and girls that have no access to any form of digital technology. And thus, their inability, especially of girls in the rural areas, to have access to education. Then school dropout through absenteeism and pregnancies and domestic violence. This, of course, is a carryover from before COVID. And whilst the prolonged closure of schools and the diminished protection from relevant authorities as resources are diverted to fight pandemic, leave girls vulnerable. And thus, the more reason they drop out of schools. Increased marriages, which were shared earlier on by UNFPA, sex transactions between young girls and older men as means of economic survival for families. And the COVID situation that we're under right now makes it even exacerbates the situation. Next slide, please. Next slide. So what are the policy solutions? Can I have the next slide? Availability of digital access. I think there is need to look at both the hardware and the software, and this to be supported to be free and affordable with internet access, especially in the rural communities. And then, of course, ensuring that in the school curriculum, the digitalization is included so that we increase the digital capabilities of both boys and girls, and more so of girls. And then ensure that every learner has the opportunity to continue their education through distant learning. And of course, let's look at use of radio and television. If we all remember, prior to use of computers, the radio was the best source of information, especially for communities in the rural areas. This is an option that we should look at for provision of education. Then attendance, expulsion, and re-entry. Important to have policies that ensure there is an increase in school attendance by providing packages. UNFPA was speaking about the packages that are provided to young women. We could have packages that include sanitary protection, school, small packages of food that girls can carry with them, and of course, any form of social protection that they would require. And then to ensure that there is re-entry into schools. And whilst this might not be an issue because of COVID, it's still important for you as parliamentarians to ensure that pregnant girls are allowed back to school, young mothers as well as married girls, to increase their ability to read and write, as well as to move on into the technical colleges that we want them to be in. And then education for women and girls, education awareness programs, and I know UNESCO as some of these programs that are targeted to parents and community leaders are critical in order to tackle the biased cultural and social norms that often impede the educational attainment of girls and achievement of these girls, and also the value of girls' education, which is so crucial. You educate a girl, you educate the whole community. Incentives, policies, and temporal spatial measures for gender parity in participation at all levels and across all subjects, especially in STEM subjects, and STEM science, technology, engineering, and mathematics. And this can be supported by quotas, by scholarships, by grants, by training programs, mentoring, extra tuition to young girls. And of course, this will ensure better representation of women in leadership. This can be supported again by quotas of women in leadership positions as well as in educational systems. And then to ensure that the budget that is being diverted towards COVID does not affect the education and the health sectors, because their resources are crucially needed. Next slide, please. Next slide. Next slide. Next slide, please.
It is on the next slide. You can go on.
Thank you. Now I'm looking at the issues that are related to well-being. For countries with nationally representative time use surveys, it has shown that at least 2/3 of all unpaid care work are undertaken by women. And I think it was either UNFPA or Caroline in her opening remarks who alluded to this. For countries like Mali, for example, it is as high as 92%. Therefore, it means women and girls care for the sick and the elderly. And this becomes a great challenge under COVID. Young girls are kept home or home from school or from daycare to be able to take responsibility of this added burden. This becomes much more needed under COVID-19. And we know there are lots of, probably let me not say lots, there are quite a number of COVID cases that are being taken care of at home that are not even in the statistics that we are sharing. And a lot of caring for those suffering from COVID-19 are at home, cared for by the women and girls, which gives them an added burden and added unpaid care work. Then the psychosocial impacts of COVID-19, it impacts families in different ways. Gender role as well as gender stereotypes can affect the family and community dynamics, causing lasting psychological damage if not properly addressed. And just the situation of working from home itself does provide a psychological impact, and more so on women and girls because they have the added responsibility, one, of undertaking their day-to-day activities. They are responsible for women, their responsibilities at work, and then the household, the pressure from the household chores. Additional pressure on women as well to earn more income as where they were previously not the financial head of the household. The added responsibility, which I've already mentioned, of domestic work, then rest on them, ending up in trauma, increased isolation, gender-based violence with very limited support from extended family and relatives. And where this is provided, the extended family and relatives who provide that support are usually women. Next slide, please. So what are the policy recommendations? Specifically on unpaid care and domestic work, the recovery policies that are being put in place by most governments right now need to recognize unpaid and care work, as well as the domestic work that is undertaken at household level by family. Often, even prior to COVID, these policies hardly looked at unpaid care work. It becomes crucial that when we look at the policies, and you as parliamentarians, when they come to parliament, you look at whether the components of unpaid care work have been included. This should lead to an increase in spending on pre and primary education, healthcare, social protection, water and electricity, with a view to reduce and redistribute between women and men and between household and the state for unpaid and domestic work, so that it doesn't all totally rest on household and especially women, but is shared between the state and household. Progressive parental leave policies are also important. I know in some countries they have 3 months, and this can be reconsidered in light of the challenges that women face. Then in relation to the psychosocial support services that I spoke to address the added psychosocial strain on women, families, and communities from both the financial pressure, the unpaid care work, the increase in social anxieties, it's important that government provides the psychological support through counselors, through access to health facilities where nurses are able to speak to families, and to address the trauma from increased gender-based violence and isolation. There is need for family visits, especially from counselors in government, and also a lot of counseling to partners. And this I'm talking about male and female partners, because gender-based violence is not a responsibility of women alone, but of both men and women. Thank you, Madam Moderator, and my apologies when my internet was breaking.
Thank you so much, Mrs. Tokosile, and thank you very much for your presentation, your in-depth presentation of the challenges and the recommendation you made on the issue of health, education, employment, and well-being. Dear participant and honorable member, we have less than 1 hour to work, and I'm getting worried because we still have some presentation that need to be made by UNFPA regional office, mainly the Western and Central Africa and the Arab countries. So before the members of parliament can react, I would like to give the floor to Mr. Idrissa Ouedraogo, which is the UNFPA representative from Western and Central Africa, followed by Mrs. Hanan Rabi. So please take the floor. But before that, I would like to recognize the presence of His Excellency Honorable Jamel Bourras, who managed to join us. And I will request the host to allow him as a panelist. I think that is done. Honorable President, voulez-vous prendre la parole maintenant ou un peu plus tard?
Would you like to take the floor now or a little bit later?
I don't think he heard me. Excellence, Monsieur le Président, voulez-vous dire...
Excellency President, would you like to say a word?
Okay. Mr. Idrissa, please take the floor then. Let's proceed.
Otherwise, we give the floor to Mr. Idrissa.
Bonjour.
Good morning, or rather good afternoon. I would like to make sure that you are all able to listen to me. And thank you, Excellencies, parliamentarians, all protocols observed. We are very much happy for our office to quickly present by taking into account the issue of time that we have to manage adequately. So let me present quickly the major elements in terms of trends regarding COVID-19 in the West and Central Africa region. With your permission, I'm going to share my screen now with you, but I will try to be very quick in my presentation.
Est-ce que vous l'avez, la présentation sur l'écran?
Do you have the presentation on the screen? Not yet. Kindly share the presentation. Yes, we have now your screen. shared.
Alors, donc, je disais que je vais aller assez
So
rapide.
I was saying that I was going to be quick in terms of a trend. The previous colleagues have already said it. All the situation analysis indicate a high increase of gender-based violence in light of COVID-19. This is due to the lockdown, which brings together all the potential victims and the potential perpetrators of these crimes. We have some data now on the region that I'm going to present to you very quickly.
Voilà, donc dans les 23 pays.
In the 23 countries of West and Central Africa region, we have a total number of 218,000 cases since March 2020, with 3,442 deaths. 28,000 cases are still active. So we do not have disaggregated data except for GBV IMS, which is the monitoring of GBV in countries. We managed to have some data, but it's not as such disaggregated. Let me give you some examples to express these, to showcase this case. The UNFPA, with the support of its partners, managed to help 2,254 GBV victims to benefit from information and services on what we call the essential services package. This means that all victims, be it in this crisis situation or outside this crisis situation, are able to benefit from the medical help regarding the psychosocial aspects, also related to police, justice, and aspects related to the deprivation of economic rights, for instance. Now, let me share with you some examples of Mali and Nigeria. In Mali, at the beginning, in April 2020, just to show, in only 1 month, there was an increase of 11% of gender-based violence in light of the lockdown. This is at the beginning of April. This means that you have to multiply this proportion by X whenever we increase the months. In these cases, we have gender-based violence, 20% of rape by penetration, 90% of physical assault, 16% of denial of resources, 21% of psychological violence, and 8% of early marriages. Despite the lockdown, we still have these early marriage issues. Somebody mentioned it earlier. We also have female genital mutilation and other types of violences as well. In Nigeria, we have more obvious data. The increase was seen in Lagos, Abuja, and Ogun State. The teams in charge of the victim support hotlines reported a threefold increase in the number of calls from March 30 onwards. This means that currently, the last meeting that I had with Nigeria 2 days ago, the data were multiplied minimum by 10. Service healthcare providers report an increase in the number of cases they receive of intimate partner violence. As you know, this was also said, the very fact of bringing together people who have had conflicts that they did not manage to address makes them vulnerable. Let me share with you the indicators. Most of the cases which are reported are women cannot remain in confinement or lockdown because of the violence. But when you ask them, and we ask them that you are in lockdown, why don't you call the police? They said that COVID-19 can kill me, but I do not want to suffer psychologically, mentally, and physically. such as gender-based violence. That is why I prefer to be killed by COVID-19 rather than killed by my partner. Colleagues have said what has been done in the countries. Now, I just presented 2 countries, but this is the trend in the 23 countries. We have 23 countries covered by the Western and Central Africa. At the beginning of the pandemic, in May, we developed a guideline made available for countries to make sure that the prevention and diagnostic tools be available to countries to trace gender-based violences. Not only trace them, but also bring some responses. This means that we have to provide the essential packages, the health, psychosocial, and the psychological support. Here we need to add one thing. How can we make sure that the information and services reach people in such a situation? Unfortunately, it was necessary not only to use other communication methods in addition to the traditional communication methods, which is to have a referral person within the community. So sometimes community relays were used. But the most important thing is that some colleagues have mentioned it. We have to put in place safe spaces for the communities. In the normal development situation, if one person was in difficult situation, then that person could go to the community and resolve the problem. But in light of COVID situation, you need to have a longer stay in these safe spaces. That is why we need to have an innovation. We need to have a safe space. But for a longer period until that person feels safe physically and mentally. This is the response that was proposed by the regional office and the country office. Coming to the recommendations, colleagues were very much clear on that. Let me say something here. Be it in a development or humanitarian situation, gender-based violence are taken into account at medical, psychological, and some other sectors. The only problem and the major challenge is at the justice and police level. And in some countries, we have some witnesses saying that some support staff are the one perpetrating the crimes. And this includes the justice and police stakeholders. So that is why, as parliamentarians, we have to see the ways and means on how these stakeholders, the police and the justice, be trained, but also have an approach so that they are well aware of their roles and responsibilities that they can play in terms of taking care of victims suffering from gender-based violence, not in humanitarian situation, but also in crisis situations such as COVID-19. So this is in a nutshell my presentation. Thank you very much for your attention. Thank you very much, Mr. Ouedraogo. I give the floor now to Madame Hanan, if I'm not mistaken. Madame Hanan, are you there?
Yes, thank you very much. Thank you very much for inviting me to this esteemed gathering. I'm very honored to be here with you. I thought that for a better understanding in outlining the impact of COVID on women in the Arab states region, it would be very useful to give some highlights on the context of the region that we're dealing with. I could see a lot of similarities between the context in the Arab region and in Africa, but I want to give a little bit more specific contextual background. The first one is that the Arab region has a complex geopolitical and socioeconomic realities where 8 countries out of 22 are in a state of formal conflict, which adds to the number of vulnerable women we're dealing with. The region composes 5% of the world's population, yet it holds about 50% of the global IDP and refugee population. 37% of Arab women have experienced some form of violence in their lifetime, and there are estimates to indicate that this as these numbers may be even higher. 14% of Arab girls marry under the age of 18. We also have prevalence of FGM in some of the African part of the Arab states, in addition to Yemen and the Iraqi Kurdistan. Discrimination against women is prevalent in almost all aspects of life and in the law as well. Nationality laws, for example, do not give women the right to pass on their nationality to their foreign spouses or their children from a foreign spouse, which creates a major problem. Women political participation remains to be low in the region. Most countries do not have the quota system for women. We have Jordan, Egypt, and Djibouti, and I'm talking about countries under the League of Arab States, have allocated 10% of their parliamentary seats to women. In Morocco, there is a quota of 15%, and Iraq has a quota of 25% in the parliament. Women representation in the justice system is even lower. While we have the number of female judges is quite low, but we have Algeria and Tunisia on top of the list with the highest number, very good number of female judges. We have only 6 out of 22 Arab countries that has drafted or passed a law to protect women from violence. However, even the laws that were passed have serious flaws related to certain articles and have not been fully operational and implemented. While the region recorded noticeable improvements in the fields of education and health for women, we have women's participation in the labor force remains to be the lowest at the global level, with a percentage of 20 to 26%. Even though many Arab countries' constitutions stipulate equality between men and women as a general principle, individual legislation and laws play a factor in, especially the personal status law, in limiting women's opportunities, equality, and full participation, and at the same time fail to provide them with adequate legal protection. In most countries, women victims of violence lack proper access to justice and lack of access to adequate social, psychosocial, legal, and health services from the government or from the NGO community. We know that the NGO community works under very challenging circumstances to complement the services that are lacking in this field. During the COVID-19 lockdown, I mean, understanding the context now, we can imagine where the situation have gone from that point on. Governments, unfortunately, do not have formal statistics on violence against women or gender-based violence. Most of the statistics come through either special surveys that are conducted every once in a while, or statistics coming from the women NGOs who are dealing with women victims and survivors of violence. As we know, women were the brunt of any turbulent circumstances and emergencies, including conflicts, including natural disasters, and the corona pandemic was not an exception. Levels of the gender-based violence have increased in all countries of the region, as reported by most countries. There were some circumstances where in some countries there was a reporting of a decrease in the number of calls that have been made to hotlines and to services, but was immediately attributed to the fact that women are restricted. They don't feel safe enough to seek help or to ask for help. In Tunisia, for example, the cases of domestic violence increased 5-fold, which was quite alarming. In Lebanon, there has been a big increase in both the government and
Madame Rabbani, votre connexion ne passe pas.
Madame Rabbani, your connection is dropping. Can you please
votre communication
be connected? Madame Hanan, we have lost your connection.
J'ai peur que nous ayons perdu Madame Hanan Rabbani.
We may have lost Madame Hanan Rabbani.
Nous avons quelques soucis pour
we have some concerns
écouter Madame Rabani.
to listen to Madame Rabani. Can someone communicate with her using other means and give us the status of a connection? Meanwhile, I would like to know if His Excellency Jamel Bourras can take the floor and say something. Madame Rabani is now reconnected, but we are not able to listen to Madame Rabani.
Okay.
Please continue.
I don't know what happened. Okay, so during the, so in Lebanon, for example, there was an increase by 60% compared to the same period in 2019. And during lockdown, both Arab governments plus the NGO community resorted to using mainstream media as well as social media in first reaching people through awareness raising campaigns and giving numbers, hotline numbers for women, and then using online communication to provide counseling services for women, to provide information in a way that can maintain safety and security for women. There were several creative ways that the NGO community have resorted to. One of them in Lebanon, for example, they advertised that all women should go to the balconies at a specific hour of the day. And when women went to the balconies, they showed them banners of the number of the hotline. So they, if they needed, they could actually contact the hotline. Now, the challenges and the coping mechanisms during this period, domestic violence and GBV was not considered a priority by many of the government institutions, as all the human and financial resources were allocated to deal with the health implications of the pandemic in general. This also included not only women victims of violence, but sometimes women who needed urgent health services, even women who were giving birth in certain instances in some countries. Security passes that were required for women to move around were not easily given to women who needed to reach victims. There were new forms of violence reported by the NGO community that emerged during this pandemic. They reported that there was a big increase in the level of violence practiced by parents against children. Violence against children was one. The other one was the change in the strata that has always formed the clients for the NGO community, meaning that an increasing number of women who were considered to come from a certain social class, women who are supposedly empowered, educated and well-off and professional, an increased number in that strata was coming for support to the organizations, while the organizations have always been more used to dealing with less advantaged women. So that created a new setting for them to try to come up with various options and methods to address these differences. Now, there was a problem also related to lack of shelter. There are shelters in most Arab countries. Some are operated by the government or the NGO sector, still need a lot of work to build their capacities. Many of the shelters were not able to receive women victims of gender-based violence because, first of all, they were overcrowded from before the pandemic. Second of all, they demanded, for health reasons, of course, a certificate of negative, that the woman is free of the pandemic. And in this case, it was impossible. Tests were not available, and restriction on movement made it impossible for women to deal with that. But the shelters reached their capacities. Provision of counseling, social services, and guidance was turned into a newly adopted approach of online counseling and online creative ways to make sure that women receive the information and remain secure and safe. In some of the countries, especially, for example, there was in Jordan that I know about, there was a very good level of coordination between security forces, the police, government officials, and women's NGOs, especially in relation to reaching women at extreme risk Not all the cases, but at extreme risks. Now, UNFPA role, I'm not going to repeat what my colleagues have said. It was very similar to what has just been said. UNFPA, for example, there are two instances where UNFPA partnered with the social ministry in Sudan for the first ever GBV hotline for counseling and for support for women. In Tunisia, there was also a positive development where in Tunisia, quarantine shelter for GBV survivors was established during the pandemic to take more and more of women who needed it. UNFPA, of course, in addition to all the services that has been providing, similar to what my colleagues have elaborated on, we have developed the essential services package, which was tested in 3 countries in the region for impact and to improve the referral system as well. UNFPA, together with UN Women and other UN agencies, continue to provide country offices with information and also use the media for a big campaign to encourage young women and girls and women to speak their stories. And there was several projects also done with the cooperation of the League of Arab States to raise the voice and encourage women to speak up. There is a big concern also related to, there was a lot of briefings that the UN agencies with UNFPA produced to alarm and alert people because of the expected at the time, and then at the actual increase of GBV in the community. We have to mention that there's a lot of marginalized women, especially in the refugee, IDPs, and the domestic migrant workers community, who have paid a lot of price in this period. UNFPA and UN Women and others are currently working on a big media campaign where they will utilize social media in a very new way to promote and broadcast messages against domestic violence, GBV, and will be launched widely during the 16 days of activism. Now, my final point is the recommendations. I think based on our experience and dealing with country offices and NGO sector as well, the recommendations would be to consolidate the service provision system with a smooth and coordinated referral system with an emergency plans in the event of emergency situation, which they can take on immediately. Support the scale-up of GBV hotlines and case management through telephone and or online to reduce exposure to COVID-19. Support national TV and radio campaigns to raise awareness about increased potential for domestic violence and inform potential victims on available services and emergency numbers. Support national efforts to increase dissemination of information on available services. Use creative ways probably to reach places like supermarkets and pharmacies, which have been available throughout the lockdown. Support national efforts to ensure provision of protection police services in cases of GBV. Monitor number of women and girls in emergency sectors in order to provide extra support if needed. Explore options for protection and safe spaces to GBV survivors with respiratory illnesses. There were cases, for example, in Gaza, where some of the hospital rooms were allocated for GBV victims who have respiratory problems. Support efforts to make counseling services available to GBV cases as well in order to support their mental health. Above all of this, having consolidated good, solid laws, legislations, and policies would make everybody's life is easier, especially if they criminalize perpetrators of violence in general and in the pandemic in particular. And at the end, I would like to say thank you very much. I think my last recommendation would be, I saw how similar the context in the African continent and the Arab region is. I think forging partnerships between the African women through the parliamentarians and other NGOs and other sectors with the Arab region will be extremely beneficial for both sides for exchange of information. Thank you very much.
Thank you so much, Mrs. Hanan Rabi. Thank you very much for your communication. And we take note of the difficult condition in which you are working in this region due to the social, political, and socio-economic environment. Je voudrais demander l'indulgence de notre collègue de la Commission de l'Union africaine et du département des affaires sociales, pour sa présentation. Nous souhaitons peut-être réaménager un petit peu le programme pour essayer de gagner du temps. Je vous propose donc que nous passions aux interventions des honorables membres du Parlement panafricain, en commençant par le président, son Excellence honorable Bourras, et les parlementaires qui souhaiteraient prendre la parole. Donc, l'honorable Bourras, je vous donne la parole.
Merci, Madame Wawa. D'abord, je remercie tous les participants de ce séminaire qui est très, très riche par rapport à la femme africaine et même par les enfants africains pour le Covid. D'abord, je salue Monsieur le secrétaire général de PAP, plus toute l'équipe de PAP et à la tête Monsieur le vice-président Sharon Bera aussi, qui est avec moi dans le bureau. Aujourd'hui, c'est une journée très riche. Je remercie tous les participants pour ce séminaire. J'ai entendu pratiquement tous les intervenants. Aujourd'hui, tant que nous, comme le pape, on présente le peuple africain, il faut absolument qu'on joue un rôle très important.
PAP represents Africans and
la protection de la femme africaine.
We want to work and we work to protect women, African children in this pandemic situation. It's very important to recognize the participation of the Pan-African Parliament. We are here to represent the African people. We are here to provide support to national parliaments for them to mentioned by one of the participants, so that they produce policies and fulfill their responsibilities. We have to communicate with all national parliaments to try to legislate to protect African women. The African women must be protected absolutely. We have seen all sorts of violence. We have issues related to COVID-19. So we have to give them the possibility to access to health services, including hospitals and medication. It's very important. That is why I would like to say that politicians should fulfill their responsibilities. We as African parliamentarians, we have to do our best to protect the African women. It is very much important. We are going to make recommendations to national parliaments, and at the same time, we're going to see with the African Union how we can make recommendations so that African women are indeed protected. I was listening to the various speakers. Yes, they spoke about African women. Yes, they are facing several issues in Africa. We have to allocate all the means to not only to protect them, but also address the education of children. Schools are closed currently because of the COVID-19, and we have to find the ways and means so that our children continue benefiting on their education. I can promise you that as President, I speak on behalf of all parliamentarians. We would try to do our best to try to support and at the same time legislate to protect African women and African children, because politicians must play their role to protect African women. We have to see as well if there are possibilities to work with all parliaments and what kind of program or planning can we put in place? What kind of roadmap can we put in place regarding African women? Because the African women plays a major role in our societies. She plays a major role in the education sector, in the protection of children, in the social aspect. So we have to give her all the means to promote African women. As she plays a major role for the continent. We have to recognize these roles and we have to encourage, we have to congratulate them for their courages, for their fight against this pandemic. And we have to make sure at the same time in ensuring the education of their children. And we have to give the right place to the African women, be it in the political, social sectors. The African women can play a major role, an important role for the continent. That is why our role to encourage the African women to be with her, to try to build this Africa, which is suitable for all, a rich continent that can provide a continent with all wealth, with a lot of wealth, and give the right place to all Africans so that we are able to build a continent that can provide the necessary ways and means to the African women, the African children, and at the same time, we would be able to build a strong Africa in the education, health, and economic sectors. I thank you very much, and I encourage you to continue in your efforts. It was a very good idea to have this day, this virtual meeting, because we have to support women. We have to encourage women. Thank you very much. I wish you fruitful deliberations. Thank you very much.
Merci, Excellence.
Thank you, Excellency. Honorable Jamer Bourras, President, Acting President of the Pan-African Parliament.
De vos recommandations, et nous allons
we have taken note of your recommendation, and we would make sure that the deliberations of this agenda lead to a legal framework at national level to protect women and young girls. We have taken note of the recommendations in terms of parliamentarians. So we would make recommendations for the Pan-African Parliament. Now, let me give the floor to Pan-African Parliament members. I recognize Honorable Carol Agito. Can you please take the floor? Honorable Carol Agito, you have the floor.
Enlevez votre micro, honorable, votre micro, on ne vous entend pas.
We are not able to listen to your intervention, honorable. We cannot hear you, honorable.
Pouvez-vous réactiver votre micro?
Can you please unmute your mic?
Vous m'entendez là?
Yes. Yes, we can hear you now. Let me recognize honorable members of parliament, dear colleagues. Let me recognize all the experts, technicians, professionals of the Pan-African Parliament. I followed the various presentations and contributions. I have to say that Africa should rise. The pandemic has not ended yet. It's still there. It continues to make its damages in all aspects. We did not prepare for this, but we need to find a ways and means to live with it because we do not know when this pandemic will end. At national level in DRC, we have developed a policy to fight COVID-19 and gender-based violence during this period. As you know, any plan, any policy should be supported by financial means. I have listened to the speaker who spoke about violence, and we have the required support, psychological support, but sometimes we lack the support of the police and the judicial system. This period did not allow us to live as we were used to. Sometimes living together in a lockdown for months was very difficult for some of us, for several families. And we have seen several cases of gender-based violence in various households. When they complain to the police or the justice system, women are not heard. That is why we needed to develop laws protecting women and for the true protection, because we have an arsenal of law in our African countries protecting women. But the real problem is the implementation of these legislations. We have the law on gender parity, for instance, the participation of women in government offices. We are one of the countries well advanced and with a lot of legislations in this regard. But the real problem here in DRC is the implementation of these laws, because those who are deciding are men. I'm not sexist, but I know what I'm coming from. My colleague women of Pan-African Parliament are fighting to voice out the voice of women, despite the existence of all these legislations protecting women. COVID-19 was unexpected, and that is why we are trying to address the major challenges that we have faced at social, economic, and security levels. We know that it is something doable, and together we can address the challenges. That is why I second the proposal, which recommends to propose draft laws that can be presented to our respective governments so that we adopt them at the parliament level, and finally we will be able to implement them. So this is, in a nutshell, my contribution at this juncture. Thank you very much. Thank you. Thank you, Honorable, for your contribution and the information that you just shared on the situation in DRC. I give the floor now to the Honorable Lucia Passos, who is the President of the Gender, Family and Social Affairs Commission of the Pan-African Parliament.
Muito bom dia a todas e a todos. Cumprimento o Sr. Vice-Presidente do Parlamento Pan-Africano e todos os
Good morning, everyone, and greetings to the President of the Pan-African Parliament, all participants, all the members attending this meeting, and all the staff of the Pan-African Parliament that allowed us to host this meeting. I'd like to thank the cooperation by the UNFPA and the African Union for hosting this event. We are all called today to face this major challenge, the post-pandemic challenge. We are all called for this because all the gains that we have had achieved in gender equality today, we can say that these gains have been shaken. We cannot say that we have the same results that we had before in terms of gender equality. We have more women who are less empowered, more women with difficulties in access to healthcare. We have more girls with difficult access to education because education now is conducted remotely. We know that rural households do not have access to devices, IT devices, and access to data networks to have access to classes. Hence, we'll have more girls with no access to education. And the consequence of this is more child marriages and gender-based violence. Today, we have a social protection system that is totally disrupted our vulnerable groups, particularly people with disabilities, who already were in a difficult situation prior to the pandemic. Today, the situation is even more difficult because people, and particularly the households who used to take care of these people with disability, they lost their income, and not all countries managed to introduce emergency measures, social inclusion measures to provide emergency revenue or income, and also food program. Today, we have issues of malnutrition, hunger, and also people with difficult access to the national health services. And this calls upon all of us, members of parliament, parliamentarians, that should oversee our national budget. We need to strengthen our parliamentary diplomacy in order to ensure that expenditure, particularly expenditure on health, is quality expenditure that will ensure access to health by everyone, and that people will have access to testing for early detection of COVID-19. And vulnerable households should have social support and protection. One of the speakers talked about care for the victims of gender-based violence. My question that I'd like to raise is, how many countries have a national care health plan, healthcare plan? So we know that we need to have a structured program to free women who care for vulnerable and people and people with disabilities. We need to free them so that they can have access to the labor market. When there is no plan in the country, this becomes more difficult because unpaid work done by women is not accounted for. So we need to have a proper plan to free women from these household chores, because we introduce a new professional category which are the caregivers, because we have a professional category called the caregivers. These are people with special training that provide services to people with disabilities in their homes. So children, toddlers from 0 to 3 years old, and children in preschools from 3 to 6 years old. So hence, women will have more time in their hands to seek additional income for their families. So I would like to know how many countries have these plans, because if well implemented, even with the pandemic, it will support families. Because I'll give the example of my country, Cape Verde. In the care and social protective plan that we have in place, we have the elderly, essentially all of those with no access to support from their families. They have a government protection through this care plan. We have caregivers that go to their homes and care for these people with disabilities and elderly. As said by the Vice President Boras, we need to revisit our laws. Most countries have laws on gender-based violence. I know that some countries have a parity law. We are already implementing it. It has been approved, and we're now implementing it. But we need to have other measures and norms in place to promote gender equity post-pandemic. Women that are most affected, unemployment has significantly increased during the pandemic, and we must be aware that 2021 will be even worse than 2020, because some households still have some savings now, but from 2021, the situation will worsen if the countries, if the parliamentarians do not do their work, which is to do advocacy, assess the national budget, and determine if they have a positive discrimination in favor of women and vulnerable groups in order to ensure the well-being of the households. We need special measures, job protection in terms of access to health, education, and access to income and funding, both for both businesses and households, because business should have access to finance in order to secure the existing jobs. If we can secure the existing jobs, we will contribute to be able to continue to fight to save lives. I think this is the major challenge now in terms of the gender-based violence, is how can we protect the victims but also work with the aggressors? We cannot forget the perpetrators. So we need to, the tendency here is to protect the victims, but leave the perpetrators, let them go free. So we need to work on the psychosocial aspects of the perpetrators. If we don't do this, they will continue to generate more victims. So we need to have an integrated program where we can work both with the victims and the perpetrators of gender-based violence. And we should not forget the issue of sexual abuse of children. We know that there's a new category of sexual violence, which is online sexual violence and abuse on our children. And during this pandemic, the situation is even more delicate because children have access to the internet and they're constantly using new technologies. Hence, parents need to pay attention to this to prevent these sexual predators to use our children. Instead of attending online classes, they are victims of sexual violence online. So these are my concerns that I would like to leave with you. Thank you very much for your attention.
Thank you so much, Excellent, your Honorable Lucia. We really take note of what you just reported to this meeting, and especially the issue of national plans. And actually, that is exactly why we are here. And I will call upon the UNFPA regional offices to answer to this question. And this new aspect of the consequences of the COVID, that is a point that definitely parliamentarians need to address, and in terms of budget allocation and the measures that government need to put in place. I didn't receive any, I received one request, which is from Honorable Kadiba from Sénégal. Honorable, est-ce que vous êtes sur la plateforme? Vous pouvez prendre la parole.
Honorable, if you are online, you can take the floor.
Honorable Kadiba.
Honorable Kadiba. Can you hear me? I see you. I see that you are connected. Can you please unmute your mic and take the floor? Honorable Kadiba. So let me give the floor to another MP.
Okay, Honorable Kadiba est là. On voit la vidéo, mais on ne vous entend pas.
Honorable Kadiba, we see your video, but we are not able to listen to your contribution. Please unmute your mic. Can you hear me now? Okay, please proceed. Thank you very much. Thank you, moderator. My name is Kadiba from Senegal. A very good afternoon to everyone and to all MPs and mainly PAP members of parliament. I was not able to follow all of the presentations that were shared this morning because I was not able to follow the interpretation. But I just want to say a few things in this subject because this is a very interesting and critical matter regarding women and the African women in general. Moderator, following the presentation or the contribution of Honorable Bourras, who is now the acting president of PAP, I can say that the African women is not earning a lot. This means that poverty is being feminized in Africa. This is very serious. Now, if we want to fight gender-based violence, then we have to address this matter. Women do not have a lot of resources. Sometimes it is difficult to sensitize women. In Senegal, we are a bit advanced in light of other countries because we were able to have a gender parity, and its implementation is now widespread since 2012. So since 2012, we were able to have gender parity at various instances. We also enacted a law which criminalizes gender-based violence, a law which was enacted, voted unanimously, and enacted by the president of the president 1 week later. And this was very encouraging. But we have a problem within the parliament because we have some lists. And when the list is ordered, if there are 3 names in the list, out of the 3, we have 2 men. Among 165 members of parliament, we only have 71 women parliamentarians. So we have not ensured gender parity within our parliament. A lot remains to be done. We also have our various cultures and traditions. In general, women feel shame to talk about violences that they suffer within their households. They think that they should not talk about this violence. This means that we have a lot to do in terms of sensitization. Again, regarding the fight against poverty, it is a bit difficult to fulfill one's responsibility when we don't have enough resources. Women fear and they do not also have resources. If they talk, if they lose their household, can she survive? Can she take care of herself? Can she take care of the members of her family? So this is the problem that we are facing. That is why I am saying we have a lot to do regarding this matter. Regarding COVID-19, medical and psychological treatment is indeed happening in Senegal. The President of the Republic took the initiative during the lockdown to support the most vulnerable ones, but it's not enough. We have noted that COVID has an impact on the economy of all countries. It's true that we have a decreasing trend of COVID-19 cases, but we need to be vigilant. We need to be careful and respect the various health measures. I do not want to monopolize the floor because there are others who like to take the floor. But remember that in Africa, we women, we need to work together. We need to rely on our respective experiences to eradicate this violence, which is extremely hampering the lives of women in Africa. Thank you. Thank you, Honorable, for your contribution from Senegal. We congratulate Senegal for the measures taken at medical and social level to support the population. We have taken note of the traditional and cultural aspect and the major problem that you mentioned regarding the issue of gender parity, which may not be at the agenda of this briefing. But this issue is an important question, and we have also the issue of poverty and fighting against poverty in relation to COVID. I do not see any hands raised. We have several members of the Pan-African Parliament, but due to time constraint, we have to go forward. We still have one remaining presentation to be made by the Social Affairs Department of the AUC by Madame Nematundu on the harmful practices, mainly on female genital mutilation and child marriage. Following her presentation, we're going to give the floor to the panelists from the UN and ECA and AUC to address the questions that are going to be raised before going to the last session, which would be the summary of the recommendations made and the expected results of our program. Without further ado, let me give the floor now to Madame Nematundu.
Madame Nematundu. Vous m'entendez?
Madame Nematundu, can you hear me?
Yes, I can hear. My apologies.
Please go ahead.
Hello. Good afternoon, everyone. Hello?
Listening.
Hello, can you hear me?
We can hear you.
Okay, good afternoon all. Let me just speak briefly on our programs on ending child marriage and FGM, which falls under the framework of harmful practices. I work in the Department of Social Affairs. I coordinate in the technical level the AU campaign to end child marriage, and I also work on FGM program. So in our perspective, from the AU perspective on the work that we do, both campaigns, the campaign to end child marriage and the FGM one known as the Salima Initiative, fall under the harmful practices framework. And in the interest of time, I won't go into, because both these projects have a lot of detail. But we do address, of course, these are both violence against girls, forms of violence against girls, and both campaigns, the AU campaign to end child marriage was initially launched in 2014. And it has been addressing a number of key areas on how to address ending child marriage with member states, and has been working with a number of stakeholders, apart from member states, with religious traditional leaders, youth, women, organizations, girls who are affected by child marriage, and other and families and communities. And so far, since it was launched in 2014, we had identified through UNFPA household survey 30 countries with the highest prevalence of child marriage in Africa. And we have been working with these 30 countries, and out of those, 28 member states have launched campaigns to end child marriage and have strategies in place on ending child marriage. And the campaign itself works in the main pillars of advocacy, technical assistance and capacity building, and monitoring and evaluation and accountability. So even when the countries launch their national campaigns, at the level of the AU, we do follow up to engage with them find out the progress on their national strategies, whether they have monitoring and evaluation mechanisms in place, and so on. And the involvement of local civil society is also very important. I had mentioned different organizations, including religious and traditional leaders, who we work a lot with, and also the involvement of local civil societies is key. So in light of the, if I may mention briefly, also the Salima initiative, which is on FGM, was launched in 2019. And the president of Burkina Faso was nominated as the AU champion on eliminating FGM. On ending child marriage, it was the president of Zambia, Edgar Lungu, who was nominated as the champion. And on FGM is the president of Burkina Faso. And the initiative is also about protecting girls and women against this harmful practice of FGM, and creating a supporting environment through strong policies and legislation, and championing gender equality and empowerment. And also, like the child marriage campaign, the involvement of communities and partnerships with different stakeholders is very key in ensuring that we take these projects forward and we see substantive results when we do our monitoring. And also on the two projects, child marriage and FGM, data and evidence is very key. Collecting key data and statistics from member states. Some member states do not have these kind of information, but we also are looking forward, and we are in the process of working with member states on one of the areas I've mentioned is on capacity building, so on building the capacity of the statistical bureaus to be able to collect this kind of data, which is sometimes not available on ending child marriage and FGM. A lot of the time there is information on when it comes to ending child marriage. There's information on teen pregnancies, but on child marriage itself, it's not always available. So now, in terms of the COVID, in this COVID circumstances that we find ourselves in, a lot of the speakers have already mentioned the vulnerability and of girls and what they're experiencing, and what has been evidence has shown. Girls who are affected by with all forms of gender-based violence. And I will not mention again because a number of speakers have already mentioned. So at the level of the AU and our project, we are working on a number of activities. Some of the activities which we're working on, we are currently doing a research from the perspective of the African Union, together with the Gender Directorate, to look at also COVID-19 and gender-based violence and girls and women affected during this COVID-19 time, and what actions and interventions can the AU take. And Gender Directorate, our colleague Ilan from Gender Directorate mentioned already that they have some guidelines. So we want to also expand our research and look at make recommendations on, what key interventions need to be taken at the national level within the strategies that countries already have on ending child marriage and FGM. What specific interventions do they need to ensure that, these practices are still high at the political level and are still prioritized? Because a lot of countries have experienced many challenges with COVID-19, economic challenges and so on, but harmful practices still need to be high on the political agenda. So this research will be looking at this kind of recommendations, and also the role of parliaments and legislation, and creating legislation which is also specific to this kind of pandemic and situation. The role of parliament is very important, and we have worked with parliamentarians before, and we have worked with activities to ensure that child marriage and FGM
so much, Nena, for your presentation, and thank you for the time that you have used very those virtual meetings that engage national parliament. You can add the Pan-African Parliament. Just want to give the floor to one of the honorable who just managed to join us, which is Honorable Rokia Romba from Burkina Faso. And then I will give the floor to the UNFPA for the almost the wrap-up of the sessions. Honorable Rokia, vous avez la parole.
Honorable Rokia, you have the floor.
Ce matin, après 6 mois de confinement et de
After 6 months of lockdown and various interventions in fighting COVID-19 who forced us to separate from one another. I am talking about colleagues from the Pan-African Parliament. I miss you a lot. And I'm happy this morning to see some of my colleagues. To all speakers, I was having difficulties in connecting. I have some unstable connections, so I would like to welcome them all, wish them a very good day. And the agenda that we're discussing today is a current issue, and I would like to bring here my opinion on this matter. As an MP, the role that we can play is to vote laws and advocacy. First of all, I would like to give my opinion in this regard. Now, it has been now 6 months since the start of the lockdown in Africa and specifically in Burkina Faso. We have to say here that a small country like ours, at the beginning we panicked and we acted in erratically. We did not know what steps to take and which interventions are reliable. And the Vice President of the National Assembly was one victim. And we are not a lot in number, women parliamentarians, and COVID has a serious impact, an impact in Burkina Faso. And you know that with the various problems related to the masks and access was difficult, and we had a policy in producing these masks in Burkina Faso, and this allowed us to cover our population. The issue of hygiene was also one aspect that needed to be addressed, but with African solidarity, we were able to provide support to the population who were suffering. And if you do not have something to eat, and now you have to buy sanitary materials, then it is very difficult for you to purchase those items while thinking that you have nothing to eat in the country. You can eat a benga and you have won your day. This is one saying in Burkina Faso. There were a lot of problems regarding COVID, and the population lost trust on the government and to the health system. There were some false statements or declarations of COVID-19 patients. And I know that worldwide there were similar cases, and people were asking now, is it not a deal of the governance to receive financing and use that fund for other purposes? And these revolted the population who barricaded or blocked some roads, and they wanted to voice their concerns. And people, through their trades, were a little bit difficult. We do not have the culture of supermarket in the African continent, so people needed to buy groceries from local stores. We have lost the Honorable. We are not able to listen to your contribution. Can you please reconnect in the following seconds? Honorable Rukia, can you hear us? Can you please reconnect? It's unfortunate we are not able to listen to Honorable Rukia's contribution. While waiting, Honorable Rukia, congratulate the government of Burkina Faso for the actions that they have taken, measures that they have taken to mitigate the financial and economic impacts of COVID-19. When she was saying the Burkina people in Burkina Faso limit themselves in around 3 rand per day or $0.18 per day. And if this revenue is not possible, then it's difficult for those population to live. Let me go quickly now. I have some internet connection issues. I just wanted to say that all persons impacted by COVID-19 are the vulnerable people. We, in Burkina Faso, we also have terrorism situation. That is why we have IDPs in our country. And these IDPs panicked a lot. And in addition to that, we have people with disabilities. In a COVID context, not only in Burkina Faso, but also in other countries, people with disabilities, for instance, those who are not able to see, blind. Now, I want to know, how did other countries were able to address issues related to IDPs and people with disabilities? They cannot respect all health measures. And in Africa, the woman is at the heart of the household. When someone falls sick, then that woman is supposed to take care of that person. That is why that woman is very much vulnerable in catching COVID-19. So if a child is sick, for instance, no mother would leave that child alone and sleep separately, especially when that person is a child. So there are some stigma in Africa, but fortunately in Burkina Faso, people were saying there would be a lot of deaths in Burkina Faso, but thank God we did not experience that. So God protected us from this disaster. But other countries were still in the lockdown or coming out of the lockdown, step by step. The case that I mentioned, how did they manage these cases? The case of people with disability, for instance. They can share their experience in this regard. Now, regarding gender equality, I would like to say something. those professional women, those women in government sector, or those women in private sector who have children. The observation is that when these women go into meetings, they are forced to carry their children with some aid, and they are forced to take one additional room in addition to what she has paid for, but the domestic worker who is supporting her child is not catered for. So now who caters for that domestic worker? So we have to consider closely this matter, so that we provide enough solution for those mother professionals who are forced to carry their children with them, along with the domestic worker, to give them support while taking care of their children.
Diviser ces frais-là par 2 ou 3 personnes, que les gens réfléchissent dessus et qu'on voit si.
Oui.
Aussi dire qu'au Burkina Faso,
we can also say that in Burkina Faso, we are experiencing cuts from the connection. So it's very difficult to provide interpretation. The connection is unstable from the honorable side. Extremely difficult to provide interpretation.
Mais ce sont des hommes, pas sur les réseaux sociaux, ont lutté. Un homme qui viole cet enfant.
So we have seen various gender-based violence. We have seen an increase of harmful traditional practices, including female genital mutilation. So that is why we have to apply the legislation. Yes, it's one thing to vote laws, but we need to focus as well on the implementation. The civil society must work on the advocacy and also communication aspect, so that every stakeholder is well aware of the existence of the legislation and takes ownership of the laws that we have enacted.
Ma connexion ne me fait pas faux bon, je pourrais prendre le train en marche. Je dis simplement que
I can say, by way of conclusion, that the contribution of my colleagues and the lady from Tunisia was very much insightful. And thank you. And President, a good day to you, Buras, Honorable Buras. It has been quite a while since we last saw each other.
Bien, merci, honorable.
Thank you, honorable. I think we have lost the connection of honorable. We have taken note of the various points that you mentioned, mainly the last item. We will communicate to Honorable Buras. The congratulations that you have put forward to him. Now, let me give the floor to UNFPA. Madame Caroline has been now been 2 hours and a half since we started our meeting. So let's go to the last session now on the expected results of this partnership, on the objectives, activities that you have planned, and the timeline as well. So what can you tell us, UNFPA, in the follow-up of this program before we formally close the session? I give the floor to Madame Caroline now.
Thank you very much, Madame Josiane, for that very comprehensive moderation and taking us through this portion. Because of time, I will just take us through very quickly, as you have mentioned, through the key activities planned that were resumed at the beginning of the meeting, and then we will quickly give an indication of the timelines. Now, a lot of the data has already been shared, and we know as at 8th September, we had slightly more than 1.3 million cases, COVID cases in Africa. And amongst those figures, we had almost 1 million recoveries and slightly more than 30,000 people lost their lives, unfortunately, to COVID in the continent right now. And so basically, the reason why we are having this partnership is because of some of the discussions we've had earlier today concerning the impact of COVID-19 on gender-based violence and national response plans to deal with the gender-based violence that has been exacerbated because of COVID. Now, just in brief, the expected partnerships, the expected results of the partnerships between the Pan-African Parliament, UNFPA, the Africa Union, and other UN agencies is to support and enhance the Pan-African Parliament's oversight role of national parliaments in passing gender-responsive national COVID-19 response plans. We have heard from all the speakers right now in this webinar, including His Excellency, the PAP President per interim, Honorable Buras, about the oversight role of the Pan-African parliamentarians in national parliamentary policy making and implementation. And so the other expected result is also to support the Pan-African parliamentarians in holding the national governments accountable in the allocation of resources, to make sure that the resources allocated to gender-based violence prevention and response, harmful practices, FGM, and child marriage, and also son preference, those resources do not get diverted to other needs and are actually allocated to the need that has been raised, and oversight for the implementation of these funds to respond to gender-based violence is actually carried out at the national level. This is also to ensure that national budgetary allocations don't take away funds previously allocated to sexual and reproductive health services, maternal, child health, and adolescent health as well. And also, as we have heard from many of the parliamentarians and the speakers, to ensure that women's representation is equal in COVID-19 response planning and decision-making in national parliaments, because this has a bearing on how the policies and the funding will go in COVID-19 response. Now, some of the key deliverables and activities, there are 4 main key activities and deliverables. There will be the guidance document, a checklist to help in the formulation of gender-responsive national COVID-19 response plan. This is just to help anybody, particularly the parliamentarians, as these plans are being designed and implemented. What are the key features that need to be part of these plans? How are they addressing issues of gender? So that is one of the key deliverables. Another deliverable would be a model law and framework on elaboration of national COVID-19 response plan, and also a budgetary allocation. We have heard from parliamentarians that sometimes the law is there, it's the implementation that is the problem. So the model, framework, or law is to support the parliamentarians to really ensure that the COVID-19 response plans are actually having a budgetary allocation to prevent and respond to gender-based violence. We're also going to have a virtual regional capacity building webinars for the members of the Pan-African Parliament, particularly the Women's Caucus and their national counterparts, just to ensure that in each of the African Union region, there's a capacity building webinar that will happen to deal with gender-responsive COVID-19 response plans. And then drilling down to the national level, we will have also virtual capacity building webinars for members of 5 national parliamentary caucuses and then relevant national parliamentary committees in pilot countries that will work with some of our UNFPA country offices in terms of support. Now, all this will happen between now and December 2020 this year, to ensure that even as we go into 2021, as one of the interveners has said, we heard from Cape Verde, the honorable member from Cape Verde, saying that 2021 would actually be worse than what we are seeing now, because some people still have savings this year, but next year the situation will be very dire. So we are looking at ensuring that all these model laws, model frameworks, the checklist are ready to support even as we go into 2021. So thank you very much, honorable participants, members of parliament. Over to you, Ms. Josiane Wawa.
Merci, Caroline. Merci beaucoup pour.
Thank you, Caroline. And thank you for this succinct summary of what needs to be done. Among the panelists who have made presentations, I recognize Mr. Ouedraogo, Madam Hanan. I also see the African Union Commission, LUAD. If you have something to add here, I can give you the floor for 1 minute each. And also to address some of the questions raised by the MPs.
If I may say something.
Yes, sure.
I think, I just want to thank you for this opportunity. I mean, sitting here and listening to experiences in several African countries has been extremely informative for me, personally and professionally. I think, looking also at the activities and the dynamics, very similar to what we have in the Arab region, I can recognize easily the challenges that you're facing in the African countries, which are very similar to the challenges that are faced in this region. I hope, as I said, that there will be more communication and collaboration between the African and the Arab parliaments. Probably we can do something through UNFPA colleagues as well. One thing related to one of the issues that was raised, I think dealing with marginalized communities, women, IDPs, refugees, women with disability, domestic workers, where we have quite a big number of migrant domestic workers in the region here, has been an extreme challenge. I think, as many of you have said, there's no magic wand to resolve the issue, but I think there is a need for consistent work and effort from both parliaments and the NGO community, governments and the UN agencies to push for adoption of policies and put in place, because this pandemic in certain ways can be seen as an alarm clock that would instigate and push governments and others into setting up solid systems for protection of women and vulnerable communities, not only in so-called normal times, but in any emergency, whether it's conflict, whether it's a pandemic, anything that would come up in the future. So consolidated efforts are extremely important. Thank you very much for the opportunity.
Thank you very much, Mrs. Merci, Madame Hanan Rabi.
Thank you, Madame Hanan Rabi. Before giving the floor to the to Mr. Gali to say the concluding remarks, I would like to remind you 2 points. The first one, this is an institutional activity, and while taking note of the comments of the MPs and the acting president, we have the duty to share this program with the standing committees, but also with the regional caucuses. And we would make sure that this program is communicated to the maximum number of MPs in all regions, and the identification of the 5 countries in which the program would be implemented by the end of the year. It would be 1 country per region that we have to jointly identify with UNFPA, but also with the Pan-African Parliment and regional caucuses. These are the items that this is the item that I wanted to raise. I see Mr. Gali, Honorable Gali. But before the closing remarks, I would like to seek your indulgence. We have two participants who connected with their apparatuses, Galaxy and G7 and HP, and we were not able to identify these participants. So I seek your indulgence if you were parliamentarians. And in the next session, I hope they will be able to connect using their names so that they participate in our session as parliamentarians. Now, let me give the floor to Honorable Gali.
Merci, Madame Wawa.
Thank you, Madame Wawa. And thank you, panelists, for the rich contributions to the agenda item that we discussed today. We have seen the major areas of the project on which PAP is working with UNFPA, and this engagement starting from this webinar. I would also like to thank the experts of the African Union Commission who made contributions on the policies that can be implemented to the agenda item we discussed, mainly the issue of gender in the context of COVID-19. I would also like to thank all other experts. Thank you for the facilitation of this session from start to finish. I would like to recognize the participation of women parliamentarians in this meeting. Their participation were very much useful. So we can be sure that this initiative collaboration would be sustainable and would be fruitful and would bear fruitful results, and it would lead to the development of the guideline for the follow-up at the Parliament PAP level in the implementation of protection measures of women against all sorts of violence, be it forced marriages, gender-based violence, or sexual violence. And these items were sufficiently raised today. I would like to thank you, every one of you, hoping that the next meeting would have a more important number of parliamentarians. I would like to thank as well the Secretariat who prepared this activity to date, and I would like to urge them to continue deploying the efforts until we reach the expected result. By way of conclusion, I would like to thank the interpreters who allowed us to conduct this meeting up to now. And I would like to wish you well, stay safe, and on behalf of the Secretary General and Honorable Buras, I would like to officially close this webinar and wish you
Merci, Monsieur
to stay
Gali.
safe. Thank you very much. Thank you, Honorable Gali. It's not customary to take the floor after the closure of the meeting. We have Senator Mukengi who sent a message through the chat option, and I invite you to read her message. So thank you very much, and have a very good remaining day. Bye.
Merci.
Merci, Josiane.
Oui, merci. C'est vrai que on n'est pas encore déconnecté.
Ouais, voilà.
Merci.
OK.
Caroline, are you gone?
Et félicitations à toute l'équipe technique du